You can begin.
Okay. Good morning, afternoon, and evening to all the distinguished guests gathered here from across the globe. My name is Parul Bharadwaj, an associate at the Global Alliance for Digital Health, promoted by the Global Council for the Promotion of International Trade. Today, we come together to explore the dynamic and rapidly evolving landscape of digital healthcare in India. As technology continues to revolutionize various sectors, healthcare stands at the forefront of this transformation, promising to enhance accessibility, improve patient outcomes, and streamline healthcare delivery. In a country as diverse as vast as India, the integration of digital solutions in healthcare is crucial for bridging gaps and ensuring quality care for all. The landscape of digital healthcare encompasses a wide range of innovations, including telemedicine, electronic health records, mobile health applications, and advanced data analytics. These technologies have the potential to address some of the most prestigious challenges in the Indian healthcare system, such as the shortage of healthcare professionals, burden of chronic diseases, and need management of healthcare resources. We are honored to have Dr. Prateep Sheikh with us today, expert in health tech and a visionary leader in the field. Dr. Sheikh's work has been instrumental in advancing digital health initiatives, emphasizing the importance of leveraging technology to enhance healthcare delivery and improve patient experiences. His insights and expertise will provide us with understanding opportunities and challenges in the digital health landscape in India. The Global Alliance for Good Health and Well-being is dedicated to promoting the growth and development of digital health technologies and practices. Our mission is to advocate for the integration of digital solutions in healthcare, support innovations that enhance patient care, and foster collaborations that drive progress in health tech. We believe that digital healthcare can transform the way care is delivered, making it more accessible, efficient, and patient centered. From an Indian perspective, the digital health revolution presents significant opportunities for innovation and growth. With a large and tech-savvy population, India is positioned the way in adopting digital health solutions. Government initiatives coupled with private sector innovations can drive advancements in telemedicine, remote monitoring, and personalized healthcare. These developments can improve healthcare accessibility in rural and undeserved areas, enhance disease management, and contribute to the overall health and well being of the population. Thank you for joining us in the vital discussion. Together, we can harness the power of digital health to transform the healthcare landscape in India and beyond. Over to you, sir.
Hello, everyone. It's Dr. Atib this side. Thanks, Parul, for having me here. And absolute thanks to Mr. Santosh. He's been running a great organization, and it's been a really fortunate part to be of GCPIT. So I'll start with the landscape of healthcare in India. I'll just share more light onto it. Yeah. So we talk about the landscape of health tech, innovations that are transforming healthcare. Particularly, we'll be talking about how wearables, biovariables, the applications of AI/ML, digital twins, and how exactly the real-time healthcare is changing the realm of healthcare operations and care delivery. So, in the tradition, we were versed with healthcare. It was just a doctor-patient mediocre interaction, but with the coming up of the health tech, so it integrates cutting-edge technology into healthcare. It could enhance outcome. It could predict the chronic conditions. So this presentation will explore more of the trends and innovations that are shaping the industry. And in the real world use case, I could bring up an example that's Teledoc. It's a leading healthcare provider, offering virtual healthcare services. So we'll be talking more with the real time and real world use cases with some examples, how exactly we could build great products that are actually market fit and what India is ready for, and how we can scale up and further fast pace the growth of the industry. So we start with the role of wearables in healthcare. So you can think of something like a smartwatch, a smart ring, and any other wearable device, which is kind of a real-time monitor, which gives you real-time health feedback, deep health insights. So couple of examples would be Apple Health, Fitbit, and the recent ones in India like Ultrahuman and Goki were actually catching up the race. So I'll just give you a real world case example. So Apple Watch is very detrimental in detecting atrial fibrillation. That's something you could just flag off if it's there any heart condition. And backing up with data, like we have more than 50%, 57% of the people who have a smartwatch or a fitness tracker. So even that's a big market share for early pre-detection of the conditions. And with the latest advancements in biovariables, so we have CGM, that's a continuous glucose monitor. We have the portable ECGs. So the few examples come chipping in is an Abbott CGM, Dexcom CGM, BioStem by NC10. So likewise, taking an example of Dexcom G6, it's a particular device that helps you monitor your blood glucose in real time. And in return, it helps to managing diabetes and maintaining the normal glycemic level and giving a real-time feedback to the patient as well as to the doctor. So that's how the technology is kind of disrupting the whole realm of diagnosis and the patient outcomes. We talk about deep health insights. It's just not about the device, it's also about the data and putting a meaning to the data. So we could run AIML algorithms that could analyze the data from the variables to EMR to generate deep health insights that could further enable personalized healthcare and early disease detection. So some examples would be predictive analysis for any kind of an atherosclerotic disease, or you having any probability of stroke. So we could think of IBM Watson for oncology, that the analyzing patient data to recommend personalized cancer treatments. So you could make it a 3D model, wherein you could actually get the data at the patient end, at the doctor end, and also you could build some strategies around. Then talking about the co-pilots of healthcare, like, catching up the AI race. So we could build co-pilots for healthcare providers by offering them recommendation insights, helping them improve the decision making and patient care. So yet again, there are a couple of examples with IBM Watson Health, ADA Health. So ADA Health AI-driven symptom checker is helping patients understand the potential cause of the symptoms and suggesting next steps. So building co-pilots around doctors, around patients, help us to provide data analytics for more precision healthcare management. We talk about digital twin in healthcare. So digital twin, they create virtual replicas of patient. Think of some person being duplicated on the digital world. We are able to, manipulate treatment programs. We could also predict models to enhance healthcare outcomes. So one of a good example would be a Philips digital twin solution, wherein we'll be able to stimulate cardiac patients with different interventions. Rather than being a lab rat, we could actually know the precision of the medication and everything. So it could have the blood test, it could have all the devices, right from your body compositions to your trackers, to your glucometers, to your CGMs, to your ECG. And the data would go to the AI or IoT based platform, and then we could build some nutritional activity, sleep, breathing, and other kind of strategies. And AIML use cases in healthcare is catching up the race with the digital side of the technology. So here we could enhance real-time monitoring, we could predict diseases, and I've been focusing more on this term precision medicine. So just putting the guesswork out of the treatment strategies, we would be able to hyper-personalize the treatment programs. For example, Google's Health AI for breast detector cancer, like the Babylon Health. And if you must have heard about Google's DeepMind AI, that's improving the accuracy of breast cancer screening in mammograms. So it's a software that sits on top of the mammogram, which analyzes the data and is able to give you precise diagnosis, which just cuts the human error. So it's not about putting the doctors out of the business, but acting as a co-pilot just to eliminate that human error and bringing more accuracy in terms of the diagnosis. We talk about the behavioral strategies in disease management. So it's all about nudging the patient, keeping them aware, keeping them engaged, keeping gamifying the whole experience. So one good example would be Omeda's health program for diabetes prevention along behavior change to reduce the risk of developing type 2 diabetes. Other good example could be psychologically based behavioral change program, like how NoomMed is trying to get the patients engaged, sticking to the program. It's all about making it stick. Then coming to the digital clone for medication strategies. So clones could manage medication strategies by stimulating patient responses, reducing errors, and optimizing treatment plans. So think about a clone wherein we could have a digital clone of a patient, and think about a twin, wherein we know everything about the patient. So the both data could stimulate together, and we'll be able to get a very hyper-precision treatment management plan that just throws out any probability of, doing the guesswork. Yeah. And other part is automation in healthcare. So automation in healthcare could streamline administrative tasks, diagnostics, patient care, improving efficacy, and reducing errors. So examples would be right from a robotic surgery to automatic patient check-ins to AI chatbots. So I'll put in a good example here. The Vinci surgical system providing minimal invasive surgery procedures to robotic assistant. So it's a good use case of automation in healthcare, which could further aid the broken health infrastructure of the healthcare. Coming to the very heated topic, that's the LLM disrupting the health tech. So we talk about a very good use case, that's MedGemini. Just put my just a minute. Yeah, so we talk about LLM disrupting health tech. So we can talk more about transforming the healthcare by processing vast data. I mean, like data that goes into million data points, aiding clinical decision making and enhancing patient engagement through AI-driven insights. So MedGemini is one of the good example wherein we know the medical modalities and knowledge. We run it to LLM model, and we have applications in classification, visual question answering, 2D report generation, 3D report generations, and polygenic risk prediction. So we could build RAGs, that is retrieval augmented generation of the information or the base knowledge that could be more of expert opinion led, and we could add uh, the learning models on top of it. So that's the whole landscape of LLMs disrupting the health tech. Coming to e-pharmacy distributing healthcare, like we all aware of 1MG, we're all aware of NetMeds. So they being a very pivotal part in terms of keeping people aware, getting diagnostics at home. It's very easy, it's convenient, but it has to be aligned and assigned along with the healthcare professionals and the healthcare ecosystem, wherein just by providing online medical deliveries, diagnostics tests, aiding teleconsultation, it could serve the larger India. And coming up to some financial data and market opportunities in Indian health tech. So we are valued at 9 billion in past year and projected to reach by 50 million USD by 25, driven by telemedicine, e-pharmacy, and the new age of AI/ML applications. So coming to the numbers, we see the trend just going high. We are, growing by 10 to 20, like 10 to 15% of CAGR. So that's the trend, where the healthcare would land. Amidst the all the saturation and the competitors out there, but still there's a room for more players to come in. So I'll also talk about some public health screening initiatives that has been deployed in India. So it's at a public health screening. So we have the India 1, India 2, India 3. So India 1 could definitely afford the treatment, but for India 2 and 3, we could certainly go for health ATMs that that could do more than 100 diagnostics at a go, and you could get the diagnostics there itself instantaneously, and then you could manage telemedicine and do the treatment programs. So screening starting from right from non-communicable to communicable. That's how we are able to hit the tier 2, 3, 4 cities of the India, bringing healthcare accessible to everyone. So the major ideation should also go about the larger India who can't afford the healthcare. So at a conclusion, I would say the health tech innovations are transforming healthcare. The whole idea is to give improved outcomes and efficiency. The future trends points to continued growth and integration of advanced technologies, including LLMs. And we have seen the real-time applications such as improved outcome patients and operational efficiency. It's just a matter of time, like how we'll be able to penetrate the larger India. So we account for telemedicine, health apps, wearable devices, pharmaceuticals and biotech, healthcare ITs, diagnostic and imaging, hospital management, wellness and fitness, medical supplies. So trying to automate and getting every one of the ecosystem on a digital footprint is absolutely, like we need to work in the sync to get treatment accessible and affordable to the last mile India. So I think Parul, we are open for Q&A. You know, if you want, I could
Thank you, sir.
stop.
Thank you, sir, for such an informative presentation. Yeah, we are open for question answers. So, first question to you is the digital healthcare landscape is rapidly evolving. What are the most exciting trends you see shaping the future of digital health tech in India?
I would want to place it in a way, I would rather subdivide this question. So one would be wearables and biovariables. So think of that the integration of advanced sensors in wearable devices for continuous health monitoring is a game changer. The devices could track vital signs, glucose levels, and other health metrics, providing real time for a better health management. Telemedicine and remote patient monitoring, post-pandemic, that really accelerated the adoption of telemedicine and remote patient monitoring tools could enable continuous care of the chronic conditions. Then AI and machine learning. So, AI is kind of revolutionizing the diagnostics, treatment planning, and drug discovery. So, AI tools can analyze vast amounts of data quickly and providing insights that improve patient care and operational efficiency. Then coming to the digital trends, creating a digital replicas of the patient, e-pharmacies, and digital prescriptions. And the most important, health data interoperability. So, seamlessly sharing of the health data across platforms, digital prescriptions. That is something that could, enhance the coordination and patient outcome.
Okay. Uh, Telemedicine and remote patient monitoring have gained attraction in recent times. How can these technologies be made more accessible and affordable for wider adoption in India?
Uh, just a second. I'm just
Yeah.
connecting my. Yeah, I'm audible now.
Yeah, you are audible.
Yeah. Okay. So we could talk about subsidized internet and devices. Talking about the public-private partnerships, training and education, regulatory support, localized solutions, and specifically mobile health units, that could be equipped, deployed health units, with telemedicine capabilities that could reach the remote areas.
Okay. Data privacy is a major concern in the digital age. How can digital health tech companies ensure user data security and patient privacy?
So we could start with robust encryption to get started, and then obviously abiding the GDPR and HIPAA compliance, regular audits, with it around tech, user consent, that's the most major part of being in healthcare, access controls, and then data anonymization, which, is using data techniques to protect patient identities while analyzing health data.
Integration of wearables and health data platforms is on the rise. How can this data be leveraged effectively to improve preventive healthcare and personalized medicine?
So first it could leverage predictive analysis. It could also help with personalized health plans. Then, chronic disease management, like, continuous monitoring of all the chronic conditions to wearables can help in better disease management and reducing complications. Then obviously real-time feedback to the doctor and the patient. Research and development, like, it's like leveraging aggregated health data from variables that could put more data to the models wherein you can extract better prediction, and then
Yes.
integration with the EHRs. That's the most important thing. Like, storing the data at the back end, where you could retrieve and make more sense out of it. So having the data and then managing the ML models on top of it, and then coming up with more precise data strategies is the way to go.
Artificial intelligence has the potential to revolutionize healthcare. How can digital health tech companies harness AI for better diagnostics, treatment planning, and drug discovery?
Yeah, so we could leverage AI in diagnostics, developing AI algorithms that can analyze medical images, lab results, and patient data that would assist in accurate and timely diagnosis. Also, implementing AI for predictive analysis to foresee disease outbreaks, patient disorientation, and other health trends. We could also leverage AI into drug discovery by analyzing the biological data, predicting drug
Yeah.
interactions, and identifying potential drug candidates. And then coming to the virtual health assistants, like, creating an AI driven Yeah, AI-driven hospital operations such as patient flow management, resource allocation, and scheduling.
There is a gap between urban and rural access to quality healthcare. How can digital health tech bridge this gap and ensure equitable access to healthcare services in India?
We could start with telemedicine services, like expanding telemedicine like a kiosk pan India, and then mobile health clinics like clinic on wheels, community health workers, uh, keeping those workers with the technology. Then already we have a lot of government initiatives in place, like the ABDM and ABHA, like where you could leverage that technology, could abide with those compliances, and you can get telemedicine to places, and certainly public awareness programs.
Collaboration between healthcare providers, startups, and government is essential for a robust digital health ecosystem. How can we foster better collaboration for faster innovation and wider adoption?
So we could start with innovation hubs and incubators that could bring healthcare to providers, startups, and government bodies to collaborate on digital healthcare projects. Then certainly public-private partnerships, encouraging PPPs to fund support digital health initiatives, regulatory sandboxes, knowledge sharing, having joint ventures, collaboration between healthcare providers and innovative startups, incentives and grants that's already being very heavily backed by the government in terms of BIRAC or CLEAP funds. So that is a collaboration that is very much needed in terms of the public, the private, and the startups.
Skilled professionals are needed to develop and manage digital health solutions. How can we bridge the skill gap in this sector?
Starting foremost, with like guiding the workforce with the technology, educational programs, industry partnerships, upskilling and reskilling healthcare professionals to adapt to digital health technologies, online learning platforms, like having an L&D departments within organization. So certainly, implementing the government-led initiatives to train and certify professionals in digital healthcare and mentorship programs. So that's the way we could, further enhance the skill set of healthcare practitioners.
There are concerns about the potential job displacement due to automation in healthcare. How can we ensure a smooth transition and create new job opportunities in the digital health sector?
So the displacement is majorly with the workforce or the healthcare practitioners who are not well with the digital part, or let's say who are not leaping the AI curve. But certainly job reskilling programs for focus on human AI collaborations, new job roles, adoption of digital healthcare technologies such as data analysis, telemedicine coordinators, and AI specialists, supportive policies, continuous learning, and also industry academia collaboration, wherein you could push more of the digital part. You could also, train them in the AI and various other things.
Yeah. Okay, like, so you have witnessed the evolution of digital health tech. What key lessons have you learned about overcoming the initial hurdles of integrating new technologies and workflows into existing healthcare systems?
So the first and foremost thing would be to kind of, keeping the current ecosystem, building products which are not really way ahead of the curve, starting small steps, trying to start with the phygital model, because the doctor patient interaction is never going to go old. So it's just by arming the doctor with technology and creating the whole digital ecosystem for the big pharmas, for the hospital management, and various other stakeholders. That's the way to go. Like just be the tech arm, and then eventually get everyone hooked onto the health tech. And then we could further deep down, looking at the trends from the west. Like if you could see US, like more than 40% of patients would prefer to go digital, but in India it's just like 5% of it. So we need to create small subset of technologies and then take it forward.
Yeah, yeah. Like behavior change is a key factor in improving health outcomes. How can digital health tech solution be designed to effectively motivate patients to adopt healthier habits and adhere to treatment plans?
So with that, I would say, sorry, come again. Can I just
A behavioral change is a key factor in improving healthcare outcomes. How can digital health tech solution be designed to effectively motivate patients to adopt healthcare habits and adhere to treatment plans?
Yeah, so for first and foremost thing would be the user engagement, keeping the patients hooked to the programs you're running. It has to be more nudging way. Let's say if I had some episode of low blood sugar levels. I should get a nudge from my platform. My app should be able to nudge me around, and then an SOS treatment plan should be given back to the patient, and wherein the healthcare professionals are involved in the whole process. So that's the way we could engage the user engagement. And also meanwhile, we also need to have some red flaggings of certain biomarkers that goes certain, like on the higher side, on the lower side, it should be nudged to the healthcare practitioner and them reaching out to you digitally. So that would be a very realistic and a practical way to get started with this.
Like we have seen in the pandemic too, burnout among healthcare professionals is a growing concern. How
Yeah.
can digital health tech solution be designed to support and empower healthcare providers, not replace them?
So likewise, I said, starting with the AI leap, we could just be co-pilots for the healthcare practitioners. So anyone missing the AI train would be left out. Anyone using the AI train, would just take himself 5 years ahead of the curve. But majoritically, it's about adapting to the new technologies, and also at the same time, it should have an improved access to the digital front. And we should be also reskilling the workflows, and likewise I said, it will be opening up new job opportunities for a lot of other stakeholders.
Digital divide persists in some regions as a country in like in India. How can we bridge the gap between technological access and digital literacy to ensure everyone can benefit from digital health tech?
First and foremost, we need to create some awareness programs, getting them hooked onto some ecosystems which they are already. So let's say I'll give you a better example. Creating a platform over a WhatsApp chatbot wherein a telemedicine could be placed very easily, and then moving on to a complete MVP, or you could say more of a very well polished product, get it fit it into some ecosystems wherein which is most of the digital, you can say, adapted people could adopt, and from there we can land up into some other platforms. So it's just start with something they're already using, and then we can just engage them into further deeper technologies.
Yeah. Measuring the impact of digital health interventions can be complex. How can we establish robust evaluation methods to demonstrate the true value and cost effectiveness of these solutions?
So we could have the KPIs coming in, around. So let's say if I have to have my other healthcare practitioners around, which are more of the physician support. So that is a cost on, the last mile India. So we could automate it, in a way, if we have to give him some nutritional strategies, if we have to give him some physical activity per se, or if we have to give him some care or some mindfulness kind of a thing, with pertaining to the mental health. Certainly those roles can be automated wherein we can bring down the cost. But at the same time, we should also have some human interaction, which at the end, it will substantially bring down the cost to manage the healthcare.
Looking ahead, what are the biggest challenges and opportunities you see for digital health tech in the next few years?
One would be the regulatory approvals, because we certainly are in a gray zone of having no approval around software as a medical device. That's one. Second would be the larger India adoption to the healthcare, digital healthcare. Third would be delivering the whole ecosystem at one place. Are the three major challenges I would see from now, like next 2 years.
Okay. What are the key learnings from past experience that can guide future innovation?
So build products around which is already being established in the mediocre way, and starting from there, getting adapted to the ecosystem which they already versed with, going small and then taking it to the further hardcore technology led program. So like I just can't say, Parul, you should be on some CGM, and you need to scan your app. You should start small. Like maybe you could just integrate a simple glucometer with your phone, and we have the data
Hmm.
at the backend, and then doctor would actually interact with you, and then putting onto you some with, I would say, more of the fancy devices that could give more data in the real time. So starting with small diagnostic touch points, and eventually landing them to the AI. And obviously, the healthcare practitioners, in getting patients involved, getting them more cultured in terms of the health digital part is the absolute need right now.
These are the questions from my side, sir. Thank you so much for such an enlightening and inspiring session. Your insights into the digital healthcare landscape in India have been incredibly valuable, and we are grateful for the knowledge you have shared with us today. Thank you so much.
Thank you, Parul. Thank you for having me.